And good evening, everyone. This is Jon Lascher from Partners in Health Sierra Leone. Today is Thursday, April 16th. Today there were 2 new cases confirmed in the country, bringing the total number of cases up to 15. Both of the cases were healthcare workers, and one of them is the first case in Kenema District. I'm really excited about today's update. We're joined by Mawuena Agbonyitor, who's the mental health lead for Partners in Health Sierra Leone. Mawuena has been working over the last year to launch the mental health program in Kono District, both in the community and at Well Body Clinic and KGH. She's going to be sharing an update about what the mental health team has been doing over the last year, as well as how the team is adapting to the coronavirus outbreak. In addition to that, Mawuena is going to share some tips about how to stay healthy from a mental health perspective during the coronavirus outbreak. And finally, Mawuena will then lead us through a guided meditation, which will help ground us and help relieve some of the anxiety and stress we might be feeling during this outbreak. Most of the people listening to the audio updates are people from our program anyway, so everyone knows you. But for those who might have accidentally found themselves on YouTube on this audio update, can you introduce yourself and tell us a little bit about how long you've been working at Partners in Health and your background?
Sure. So my name is Mawuena Agbonyitor. I am an adult and child and adolescent psychiatrist. I've been working for Partners in Health for a little over a year. I'm half Sierra Leonean, half Ghanaian, but that's being half Sierra Leonean, that's why I wanted to come and work in Sierra Leone.
Amazing. And so you're leading a mental health team. It's a new mental health team in Sierra Leone. Can you talk a little bit about what the mental health team is focused on? And then we can hear a little bit more about what they're doing to respond to coronavirus.
Sure. So right now on the team, we have me as a psychiatrist, 1 program manager, 3 clinicians, 3 other clinicians. 1 is a community health officer. The other 2 are psychiatric nurses from Nigeria who were brought under ECOWAS exchange. And then 3 psychosocial counselors and 8 community health workers. And the work that we do, at least in Kono District, is centered around Well Body Clinic and the mental health clinic at Koidu Government Hospital. So at Koidu Government Hospital, we're seeing patients in the clinic on an outpatient basis. We're also addressing any psychiatric or mental health needs of patients on the wards through consults. And we also go into the community and do home visits for patients who have more severe illness and are unable to come to the clinic. And then also we have a special program where we are particularly engaging homeless individuals with mental health problems. And there we provide a more intense supportive program where, other than medication and counseling treatment, we're also supporting them with acute needs such as food, shelter, and clothing. And then at Well Body Clinic, we have 3 CHWs who are placed there out of the 8. And so they also participate in the homeless program, engaging patients through that. And also supporting the work there around patients with epilepsy and mental illness who receive treatment there like any other patient would at Well Body.
And is the homelessness situation in Kono similar to the homelessness situation in the U.S., or what's the burden like for homelessness, and why are people homeless?
Yeah, I think homelessness definitely looks different in Sierra Leone compared to the U.S. In the U.S., you'll see a lot of places, unfortunately, where there'll be many homeless people who are congregating. So they're kind of like sites. The number of homeless individuals is so large. There are areas where they'll come together. In Sierra Leone, the numbers, at least in Kono, the numbers of homeless individuals don't seem to be at the level as in U.S., which is good. Generally, I think that's because a lot of times families and communities really support one another to kind of take care of each other so that people aren't left on their own. Even the homeless individuals that we've engaged, it's been very fairly easy to find a caregiver in the community to help us to take care of them. But generally, the reasons why people are homeless are they've been displaced from their original home, which has been far away. So they're from another city, or they're from a village that's further away. And sometimes because of the mental illness, they may not remember where their family is or how to get back in touch with them. I'm sure a lot of this displacement, a lot of our patients were displaced due to the war, the Civil War. And again, due to being ill, weren't able to find their way back to their families. So yeah.
Wow. The situation facing, mental health in Sierra Leone, I imagine, is even more complicated because of the Civil War and the trauma. That's a very recent trauma. And then also, even more recent is the Ebola outbreak. What are you seeing as mental health issues that you're dealing with mostly at KGH Wellbody and around the communities?
Sure, yeah. So trauma is definitely an important piece. I will say that because the trauma is so collective, though, it's kind of like a baseline. So we rarely see patients who the primary complaint is some type of trauma symptom. It does happen, but it's not the primary complaint. A lot of what we're seeing is that people have other psychiatric illnesses, and trauma is kind of something that is worsening the situation or worsening those symptoms. And that could be due to many factors. One could be kind of the collective nature of the trauma, so people don't recognize really that this is a mental health issue that can get treatment. And two, also could be that due to being a relatively new program, a lot of times you find that when mental health programs are being established, the first kind of types of diagnoses that come in are the ones that are most noticeable, like psychosis, or in the case of Sierra Leone, epilepsy, since in Sierra Leone, epilepsy is under mental health. So we see a lot of patients with psychotic symptoms and with epilepsy because those are more noticeable. I'm sure as the program continues, there'll be greater and communities learn of our services and are more familiar with what is mental illness. There'll be more patients coming in with kind of quieter, not as obvious mental health issues such as depression and anxiety, and occasionally trauma, where people can kind of suffer with these illnesses without others being aware.
What are kind of the biggest accomplishments or the biggest transformations or biggest changes you've seen in the year since you've launched this mental health program?
Oh, so many. I'm so proud of our team. We work really, really hard, and we really work together as one team and one unit. Definitely one accomplishment would be our street psychiatry program, because that was something that was started around little less than a year ago, and there's been a lot of great strides in that, in terms of we've reunited a lot of patients with their families. We've provided shelters to some patients, and a lot of the patients are getting better clinically from their mental illness, because a lot of the patients have psychotic disorders. And it involves every member of the team, every level, and for all of us to work together as one unit. So I'm really proud of that work and the way that it's continuing. And I think it's really important to continue even within the context of coronavirus. I also think that the number of patients we see at the mental health clinic at KGH has greatly increased too, since the team has been assembled. And so that's also indicative of the way that the communities are learning about the services that we provide and are willing to engage with the clinic. And also, so it points to the quality of work that we give too.
And how's the team holding up right now, given the coronavirus epidemic?
I think much like everyone else in Sierra Leone and around the world, there's some anxiety, absolutely, about being personally infected with coronavirus, how this is affecting your family. You know, a lot of the structures and systems we rely on in society, such as schools, going to markets, things like that, have had to be shut down. And so, like things like childcare are now newer concerns than they were before. So I think that's all lending to some general anxiety. But we do a lot of talking with the team about recognizing that anxiety and self-care, relaxation techniques you can do, problem solving, and supporting one another through this. So overall, I think we're doing well, but there's some understandable anxiety there.
And are there any changes to the program you guys have made, or are there any specific programs that you're starting because of coronavirus?
Yes, absolutely. There's been some changes to the way we provide programs just in order to maintain the safety of the staff and of the patients. So we've reorganized the clinic space so that people are able to socially distance the appropriate amount of meters, around 2 meters from one another. Providing hand washing facilities right outside of the clinic so that all those who enter are able to wash their hands before coming and after leaving. And then the way that we approach our community work has also been adapted. So we're really telling staff to not go into people's homes unless there's some medical emergency situation, and definitely and reinforcing IPC and hand washing techniques before entering people's compounds. Yes, those are some of the adaptations that we've instituted.
There's a lot of anxiety around the world around coronavirus, and you know, in Sierra Leone, there's a partial, I should say, national lockdown, encouraging people to stay indoors, which is not possible for a lot of families here. And I was hoping you could share some tips for staying healthy during this period.
Yes, absolutely. So again, this feeling stress and anxiety, discomfort during these times, I just want to stress that these are completely normal reactions, right? So it's not indicative of people now having a mental health problem. But one thing that could be helpful to remember is to know that you're not alone. And, you know, due to the social distancing that is required to fight COVID-19, it is very easy to feel isolated. But for some people, remembering that this distress is kind of communal can be helpful, and that also the solutions to this distress can also be found in our community. So by checking in with one another through calls, texts, emails, sharing uplifting stories, accurate information around COVID-19, these are things that we can do to support one another to so that we can feel less alone and less isolated. Also, for some people, COVID-19 has shut down a lot of the systems that we use in society. People might not be able to work their usual jobs. I know that's not as applicable to the PIH Sierra Leone staff. You know, for the PIH Sierra Leone staff, a lot of us might find actually renewed purpose and motivation during this pandemic because we know that the work that we're doing is bringing needed healthcare to so many people in Sierra Leone. But for other people whose jobs may have been adapted or postponed, there could be some discomfort around figuring out what is now my new purpose or functioning during this time period. And sometimes just remembering that doing your part by following the guidelines, staying home as much as possible or to yourself as much as possible, maintaining appropriate distance from others, that these are actually really vital services that you're providing not only to yourself, but the whole community and to the country. And so this could be your new purpose for this time period. Another tip is that as much as possible, you want to kind of maintain routine. within the local guidelines. So maintaining your regular sleep pattern is important, even if you're not leaving the house or your living area to go to work. And also keeping up your hygienic practices as much as you can is also important. And just being mindful that even when fetching water or washing clothes, to try to maintain social distancing guidelines as much as possible. Another tip is to limit your exposure to the news, because sometimes that could be anxiety provoking. And so it might be useful to just choose small windows of time to look at the news and to make sure that your news comes from official sources, because looking at stories from unofficial sites can worsen your anxiety if the information is not truthful. Another tip is that if you are confined inside to your home, try to find time and space for some type of physical activity within your home, or if you're able to go outdoors within local guidelines, just find some time to get some fresh air and be outdoors. And another thing to remember is self-care. And in terms of self-care, what I mean is finding time to find joy each day. So this looks different for different people. For some people, it could be listening to music. Other people, it could be praying. For other people, it could be watching a movie. Others, it's just singing to yourself. Whatever it is that provides you joy, to remember what that thing is and to make time for it each day if possible. I think also it's important to remember within the context of Sierra Leone specifically that COVID-19 could be triggering bad memories or nightmares, flashbacks of Ebola or other communal stressful events that have happened in the country. So, this is a response that could happen, and it's important to be mindful, therefore, of your stress levels. When feeling overstressed, sometimes it can be helpful to just pause and use what we call a grounding technique. And grounding techniques is where you focus either on your breathing or you focus on touching a nearby surface, something that's within your immediate physical environment that can bring you back to the present instead of focusing on that bad memory or that bad event that you've been triggered into. Also, in general, even if COVID-19 doesn't trigger past traumas, it's causing anxiety and panic in everyone, right? So again, it could be useful to pause if you're feeling that you're starting to become panicked or over anxious. And if you have a specific project that needs to be done, it could be helpful to kind of break that project up into small, achievable tasks, and then focus on completing that task and do that one by one until you're finished. Other ways to combat anxiety are to schedule worry time each day. And so this is when you set aside 15 minutes each day that you schedule. And if any worry pops up before that time, you tell yourself, you know what, at 5 o'clock, I'm going to give myself time to worry all about those things. And then during those 15 minutes, you really use that time to just go through each of your anxieties, why you're worried over and over and over. And a lot of times people find that at the end of doing that, they don't feel as anxious anymore. And then also within kind of like stress busting techniques, it could be useful to do a meditation or a relaxation exercise to help you remain calm.
Amazing. Thanks, Mawuena, for sharing that. I think there's a lot of tips there that I'm going to apply for myself during this period, because it has been, I think for everyone working at PIH, it's a reminder of past outbreaks. And, here, obviously, most recent is Ebola. So thank you for sharing those tips.
In full disclosure, to help me address my anxiety about being recorded, I wrote down all of these tips so I can share that with you to give out to staff too.
Oh, that'd be great.
It will be written down in numbered format.
Awesome. Thank you so much. So now you're going to lead those of us who are listening through a 1-minute guided meditation.
Yeah, so what can be helpful in order for you to really realize how useful this meditation is for people to kind of rate their anxiety out of 10 beforehand and afterwards to see how helpful the meditation was. So Jon, if you don't mind, I'm going to ask you to rate your anxiety out of 10, with 10 being the word, like super anxious, and 1 being not very anxious. What number do you think you are at right now?
I'm hovering, I would think, between a 6 and a 7, I think. And I say that recognizing of the people who are facing the most risk right now, I'm like, I should be a 1.
No, a 6 or 7 is perfectly fine. And I'm glad you brought that up because, we feel what we feel. We can't control it. We just control behavior. So it's great that you actually recognize that you're having a 6 or 7 anxiety, because that's appropriate, and hopefully that this meditation will help to reduce that. So we'll see. Okay. So for this exercise, it's helpful. We're going to do a deep breathing exercise. And when we do deep breathing, we want to breathe from the belly. So when you inhale, you want to pretend like you're blowing up a balloon in your stomach, right? And sometimes one thing I'll do is I'll place one hand on my belly so that I'm sure that I'm feeling the sensation of my belly expanding and that I'm breathing from my stomach. So we're going to be counting our breaths, and we want to focus all our intention on breathing. During this time, other thoughts are going to come to your mind, and that's normal. So don't get frustrated by that. Just notice that these thoughts are happening and then return back to the breath as soon as you can. So what we'll be doing is that as you inhale, you silently can think to yourself 1. As you exhale, you count 2. Inhale 3. Exhale, you count 4. And we'll do that all the way to 10. And we're going to repeat that 3 times. For the purpose of this exercise, I'll be counting out loud, but you don't have to do that when you're doing it on your own. So, Jon, are you ready?
Yes.
You got your hand on your stomach?
I do.
Okay. All right. So, inhale 1. Exhale 2. Inhale 3. Exhale 4. Inhale 5. Exhale 6. Inhale 7. Exhale 8. Inhale 9. Exhale 10. Again, inhale 1. Exhale 2. Inhale 3. Exhale 4. Inhale 5. Exhale 6. Inhale 7. Exhale 8. Inhale 9. Exhale 10. Last time. Inhale 1. Exhale 2. Inhale 3. Exhale 4. Inhale 5. Exhale 6. Inhale 7. Exhale 8. Inhale 9. Exhale 10. How did that feel?
Going into it, I'm not going to lie, I was thinking this is going to be pretty strange to do this recorded with a microphone and everything else, but no, it was really, really helpful. And I think we're lucky to have your voice leading it because it's so calming and grounding, as you mentioned, being grounded is an important element to this. So It was great.
That's great. Did your anxiety levels go down at all? Like right now, how would you rate your anxiety?
Way lower. I wish I had done this before I started recording, because I feel like think some of the tips that you provided, I think these audio updates in general have been an attempt by me to create routine and to have connection with the community around Partners in Health that we've built. And I think because I'm not in Kono right now, and because it's harder to be present with all staff in meetings and at the hospitals and clinics, it's just a good way to feel connected, and it's a routine that's been really helpful to me. So yeah, I think finding creative outlets has been a way that I'm coping myself. It's been great. And my anxiety now I would rate very low, 2, 3, something like that. I don't know, but much lower.
No, that's great. I think, well, one, I think these audio updates have been a great idea in kind of unifying the whole team. So I think it's helpful for you, but it's helpful for all of us as PIH Sierra Leone, so we can check in on one another. So thank you for providing this format and doing this. And two, just around the meditation piece, deep breathing is always really great for anxiety because it kind of slows down our fight or flight response, which is activated when we're anxious. And also I like it because it's quick and something you can do kind of to yourself. So anytime you're feeling anxious, a lot of times you can kind of do it silently without people knowing. So you don't have to broadcast that you're feeling anxious too. So I hope people find it useful, and I'm glad that you found it useful, Jon.
Thank you so much, Mawuena. And I'm sure we'll be checking back in with you for more tips and just to hear how the mental health team is doing. But I really appreciate all the time.
No problem. Thank you, Jon.
Thanks, Mawuena. I'll talk to you soon. Thank you, everyone, for listening. Thank you, Mawuena, for joining us. And we'll be sending out a list of tips that Mawuena shared by email today. And in addition to that, for Partners in Health Sierra Leone staff members, there are mental health services available to you. I'll be sending out some information about those as well. Tomorrow, we'll be joined by Dr. Chembe Kachimanga, our Director of Clinical Programs. He's overseeing the community-based response to COVID-19 in Kono District, so he'll be telling us a little bit about the response so far in the community. Thanks, everyone, and talk to you tomorrow.